Good morning. I'm Don Walker. I'm Communications Director for Brevard County Government, and we're here for our bi-weekly pandemic update. We will be paring down our updates in the future, so please stay tuned to our website to find out when our next updates will occur. In the meantime, we have with us today a panel that includes Maria Stahl, who is the Administrator for the Florida Department of Health, Brevard, John Scott, our Emergency Management Director. We also have Ian Golden, who is our Director of Housing and Human Services. And we have Matt Wallace, who is our Public Safety Director, along with Jesse Ray, our Social Media Specialist, who will be monitoring the Facebook Live event for any questions that may be posed that we can answer before our program ends today. So for a update on the pandemic, I will turn it over to Maria Stahl for the latest. Maria?
Hi, thank you, Don. I'm Maria Stahl, again, the Administrator for the Health Department here in Brevard County. Current update as of today, we have 41,444 cases. Our cases have increased by 94 today. Our positivity rate today was 5.05%. Overall, our positivity has been 14.04%. Our deaths are at 866. We have added no additional deaths today. Of note with the deaths, 47% of them are related to long-term care facilities, and that number has gone down. In the past, we were closer to the 50% mark. Our hospitals continue to be stable. The ACA report has our hospitals at 44 patients in all of Brevard hospitals with a diagnosis of COVID. When we look at our two-week rate of positivity, our range has been from 4.77% to 9.99%. Overall, for the last 2 weeks, it's been 6.19%, which is a slight decrease. In the last 2 weeks, the range of positive cases have ranged from 63 to 171. Of a positive note, the last 5 days have been less than 100 cases, so let's hope that continues on that trend. The average age of our cases continue to be the age 30. Moving on to the vaccine front, we've had 238 residents who have received at least one dose of the vaccine. We have 190 that are completed with their series. When looking at the population of 16 plus, 49% of our residents have received at least one dose. 50 plus is 64%, and 65 plus is 75%. When looking at the state overall, for the 16 plus, we are right at the state average. For the 50 plus and 65 plus, we are a little below the state average. And then the last thing I'll say, I strongly encourage everyone to please get the vaccine. If you're eligible to get the vaccine, we have plenty of supply here in Brevard County. At the health department, we are no longer requiring appointments. You can just come in and get your vaccine. We are primarily using the Moderna vaccine at the health department. And then the other thing is we are partnering with emergency management, parks and recs, and the libraries, and I know John will talk a little more on that, but we are going out through the month of May doing vaccines out in the community. So that's what I have. Thank you, Don.
All right, thank you, Maria. As Maria mentioned, emergency management has worked hand in hand with the Florida Department of Health since the pandemic first came to Brevard County. And I will turn that over to John Scott now so he can talk to you about vaccine operations. John?
Thank you, John. And good morning, everyone. My name is John Scott. I am the Director of Emergency Management for Brevard County. And I want to touch on a couple of things just to build off of what Maria said. We talk about supply continues to meet the demand we're seeing, which is excellent news from a supply standpoint. We now got to work on is making sure we're getting folks who want the shot the ability to get the shot, and we're getting that out more and more into the community. And when we talk about it, it is widely available. It's not just available at our health department here in Viera, but we know it's available through our pharmacy partners, our Publixes, our CVSs, our Walgreens, our Walmarts, our Sam's Clubs, our Winn-Dixies. We know that it's available through the hospitals as well, via parish Health First, and the Steward system. We also know that it's increasingly available in doctor's offices, in urgent care centers. So as that continues to increase, that is all good news for us, because that's where ultimately we want to get to, right, which is it being widely available in the traditional healthcare setting. So that's great news. And as that happens, it allows us, an emergency management and the health department and our other partners, to really shift our focus to an outreach and getting out into the community and bringing that shot closer and closer to folks who need it, especially those in underserved communities, those with transportation or technology barriers. So I think, Logan, I think you have the slide for the outreach schedule. If you could pull that up. As Maria talked about, we have partnered with libraries and community centers, both through our Parks and Recreation department and then several cities' Parks and Recreations departments to make available vaccines. It started on yesterday, and then will be available every Monday, Wednesday, and Friday during May at those locations from 10 to 2. No appointments necessary. People can just walk in and get vaccinated. The vaccine will vary a little bit, as sort of depending on availability. It will go with sometimes it will be Johnson & Johnson, other times it will be Moderna or Pfizer. Just sort of depends on what we have available. But for any shot where there is a second shot required, so Moderna and Pfizer, we will return to that same location in either 28 or 21 days to make sure we have a second shot. And we continue to also partner with the state of Florida on their mobile vaccine van operation and try to get those out into the communities. And that's what we will continue to do as we go forward, continuing to focus on bringing the shot closer to the community. The last thing I will say, and again, just to echo what Maria said, is with COVID vaccine being widely available, we strongly encourage folks, please go get vaccinated. It is increasingly closer to you. We know that all of those partners I mentioned have availability. Many of them are going to walk-up opportunities. So we talk about, the pandemic from a disaster perspective. We talk about the idea that, this is how we recover from this particular disaster, is through our vaccinations. And we know that in all disasters, recovery is community-driven, neighborhood-driven, family member driven. So we all have a responsibility to each other to encourage those we know to go out and get the vaccine and make sure that we're sharing information on where to go. We will recover as a community, and this is how we get stronger. So please, 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 if you have the opportunity, please get vaccinated. Don?
So this is roughly our 20th Facebook Live event during the pandemic, and one thing we've discussed in previous pandemic updates are programs that the county's had in place to help folks in need, whether through financial means or other means during the pandemic. And one of those is a rental assistance program. And we have Ian Golden with Housing and Human Services here today to tell us more about the status of that program. Ian?
Thanks, Don. So as Don mentioned, our emergency rental assistance program, applications are available at every county library. They're available on the county website, where you can download it and fill it out. And any library is where you can return them to. Along with your backup documentation, you can return them to our office here at the Government Center in Viera. We've partnered with the 4 major cities, Palm Bay, Melbourne, Cocoa, and Titusville. You can return applications there. They'll help you get them to us. And then we also, as a link on the county's website under Housing and Human Services, we also have a link to a fully online portal where you can complete the application and upload documents and submit them directly from that website. The program itself, we're about 2 months into operations. We have received about 801 applications. 2 of those are actually from out of county, so I do want to remind people that this program is only for Brevard residents. 71% of those applications are from our municipalities. We've approved about 56% of those applications. About 16.6% have been denied. because they don't meet eligibility requirements. And we've got about 25% that are we're still waiting on documents from the applicant themselves. We've approved 1.3 million in invoices. We've obligated 2.5 million in invoices, or in actual dollars underneath the program. And so, I would encourage you, I've spoken before at one of the earlier Facebook Lives, don't wait for an eviction notice on your door. Apply as soon as you can so we can move this process through. Because of the requirements of the program, there are certain priority categories that we have to serve first. And so your application, if you don't fall into one of those categories, could take 3 weeks or more to process. So I encourage you, apply as soon as you can. And then, I'll answer any questions if any come through to Jesse.
All right, and the county has received notice that we will be getting additional federal stimulus dollars. We are currently awaiting a word from the federal government on how those dollars can be allocated once they are in our bank account. And now I will move it over to Jesse Ray for any questions that have been posed during our broadcast.
Awesome. Thanks, Don. So we do have a few questions. One of them is, so someone has had COVID, which means we now have the natural antibodies. Is that good enough, or do we still need to get vaccinated?
It's still recommended that you do get the vaccine. You do need to wait till 2 weeks after you've had the COVID to get the vaccine. We do not know how long the immunity is from having the disease, so it is important that you still get the vaccine.
Excellent, thank you. And Maria, when you give your statistics, are you only talking about Brevard County residents?
Yes, I am.
Okay. And we have, so with the interest and volume of people getting the COVID-19 vaccine dropping, what type of marketing efforts and other approaches will the county and the health department be doing in the coming weeks to persuade more people to be vaccinated?
I'll take it to start with.
Thanks.
From a county perspective, we'll continue to get the word out about all of the different outreach opportunities we're doing. We'll continue to share information. We've been posting a community report, which is available on our website. We try to highlight different things there. So we're going to continue to really share that message about, again, the focus to get shots out into the community. But I would also ask, like I touched on earlier, we really, this will all be driven by how much we do as a community, not necessarily what we do from a governmental perspective. So it's neighbors talking to neighbors, it's family members talking to family members, making sure we know and they know where to go get good information and where the shot is available near them, and really encouraging them to do so. That's how all disaster response and recovery really works. And we're in that phase right now.
Well, and I want to mention too that there was a graphic shown earlier in this event that that's the information that we're putting out on social media and also on our Facebook pages on our vaccine outreach operations. So we will continue to get that, spread the word out by posting those flyers and sending out releases to the media so they'll know that those operations are in place.
Thank you. Ian, what are the priority categories for rental assistance?
So per the law that was passed in December, we have to prioritize any household that is at 50% of area median income or has been on unemployment for the 90 days prior to their application date. What we've actually just done is an amendment to our policy, and we further refine that based on the applications and the needs that we're seeing in those applications. So while we still have those as the two priority areas that the law requires, we further prioritize that if you meet both those criteria and you have an eviction summons, not just a notice, but a summons for a hearing, you're actually the highest priority under our program. Underneath that is having both of the law's requirements or priorities and having a past due notice from a utility. And then we drop down to if you have one of those priorities from the law and a eviction summons, and then we keep going down from that. What that basically means is if you've applied to us, 2 weeks ago, and you're not on one of those priority categories, and somebody with a priority applies today, their application will move ahead of yours. So that's why I was saying it's important to make sure that you get your application in as soon as possible for us to begin processing and maintaining that processing.
Okay, excellent. Maybe Maria, maybe John, what do you think are the reasons that so many people are not getting the vaccine, even though it's now easily available, and how will that affect the efforts to reduce case counts here in Brevard County?
I could go ahead and start and then hand it to John. I really can't speculate as to why anyone has reasons for not obtaining vaccines. We have some people that are not willing to take any vaccines. So, but I really cannot speculate on that. I can say that truly Brevard County has done an excellent job with the percentage of population, especially over the age of 50, that have received the vaccine. But it is important that we do get this percentage higher. We do want to reach the level of, if we're not reaching herd immunity, getting close. We do want to cut the transmission and prevent variants from forming. So it is important, but as to why, everybody has their own personal reasons why they don't want the vaccine, but I would strongly encourage everyone to really research, and the vaccines truly are safe, and to get the vaccines. John, I don't know if you have anything to add.
No, I agree. Again, it's widely available, and it's going to be a neighborhood by neighborhood, community by community, friends and family discussion, making sure people know where to get good information, know where vaccines are available, and if for whatever reason there's a barrier, then let us know and we'll get in there to help. But at this point, this is a community-led operation.
Thank you, guys. So, John, we brought up the calendar of our events here in Brevard County, and there's a bit of concern about the fact that they don't know which vaccine is being offered, which days and which locations, and primarily because obviously Pfizer is okay for our younger population. So is there any way that we're letting people know so that they don't drive there and then find out it's a vaccine they can't have?
Yeah, so as we get closer to each event, we'll publicize what vaccine they're going to get. So, a couple days out when we have those numbers, we know what's available. When we develop the calendar, we try to figure out which would be more critical for people in their planning process. Date and location in advance, or the vaccine that we're going to have available in advance. The vaccine is a little bit more dynamic than the date and location because it just changes based on what the health department gets in, what our partners get in, and what's available at the time. So we went with the date and location as, let's go ahead and get that out there. Let's go ahead and make it available so people can plan appropriately. And then we'll update them on as far as what the vaccine is in advance of that. I think that's the most effective and fair way to do it. I would also say that when it comes to vaccine shopping, if you're 16 or 17, Pfizer is your only option right now. But beyond that, if you're 18 and older, whatever shot is available to you that you can get is the one we encourage you to get. You heard Maria talk about it earlier. They are all safe. They are all effective. We want folks to do it. As far as Pfizer goes, for those teens, 16 and 17, Parrish has it. Health First has it. CVS and Walgreens have it as well. So it is available for folks in other avenues.
Gotcha. Thank you. We had a question about what are you doing to prioritize high infection areas like Cocoa that are also transportation challenged in the vaccination distribution? And I know I'm looking at the event schedule right here in front of me, and we have at the Cocoa Library on Wednesday the 12th, we have a vaccine event from 10 a.m. to 2 p.m. And on Wednesday, the 26th, at Dr. Jolie Smith Community Center off of Stone Street, we also have a vaccine event happening from 10 a.m. to 2 p.m. I don't know if there's any other things that you want to add to that, John?
Sure. Again, we're very focused on outreach and really shifting our efforts there. In addition to the two you mentioned, we'll have a state mobile van there that we just confirmed next Saturday, the 15th, at Travis Park in Cocoa. And this past Saturday, we were at Provost Park in Cocoa. And I think we're up to about 7 outreaches in the city of Cocoa that we've done to date, maybe 6. I'm gonna see where my numbers are. But like, we continue to target those areas, again, like I talked about, those areas specifically that have transportation issues and technology barriers. The idea behind community centers and libraries where these are often walkable for the surrounding community that they access all the time. So again, trying to get that shot as close to these folks as we can.
Thanks, John. We just had one come in. Can you please speak to the vaccine emergency use, EUA, versus normal vaccines?
I was going to say, yeah, I can take a stab. The EUA is the emergency use authorization. What that states is that the efficacy and the safety has been established and it has gone through FDA. It hasn't gone through the full process, which I think we're actually pretty close on a few of the vaccines to get the full approval. But the safety and the efficacy studies have been done to establish the emergency use. So that's the difference. It hasn't just gone through the full process, but the safety and efficacy has been.
Okay. And are we tracking any complications with the shots either on a nationwide, statewide, or Brevard-wide?
Any adverse reactions that are reported to us or an individual can do that themselves also. An adverse reaction they do report to the federal VAERS system, and then the investigation happens at the federal end.
Okay, excellent. And I think our last question, I know there's a bit of a delay with Facebook, but the last question that I'm seeing, do we have mutations here in Brevard County, Maria? And do you know kind of what they are, or, you know?
I can report on the variants. We don't have any mutations that have been specifically been established in Brevard County,
Sure.
but primarily the variant that we're seeing here in Brevard County is the UK variant, and that is the B.1.1.7. I have to put my glasses on here. B.1.1.7 is the UK variant, and the variant that we're seeing in Brevard County is predominantly that. We are seeing a few of the B.1.429 and the B.1.427, which are the California variants.
Okay. And I know that you just kind of spoke a little bit about reporting a side effect of the vaccines. Could you repeat that just one more time? I'm going to try and type it out for them.
Yes, it's the VAERS system, VEARS system. And that is on the CDC website. You can always report to the facility that you got your vaccine from, and the report can be made that way also.
Okay. And I think that's really all we got today, Dawn.
All right, thank you, Jesse. So as I mentioned at the start of our program, this will be the last of our bi-weekly updates on the pandemic. We will be posting any announcements of any subsequent briefings in the future, so stay tuned for those, please. And in the meantime, as we stated here today, please get the vaccine if you can get to one of these locations that we've announced, or to the Florida Department of Health office in Viera, and please follow the CDC guidelines. Thank you very much.